Good afternoon, everyone, and thank you for joining us on the news briefing for this Wednesday. When can a vending machine save your life? Well, it can when it stocks Narcan and fentanyl test strips. The health department is celebrating the launch of 4 new kiosks this week that will stock that very thing. And we are very pleased to have staff from the health department here to talk about this. We have Lindsay O'Leary. She's the deputy director of the County of Monterey Behavioral Health, and Shiba Sumeshwar with the County of Monterey Health Department. Ladies, thank you for being here. Please get us started and talk about this fantastic vending machine project.
Hello, thank you for the invitation to talk about this new initiative with our health department. And we're really proud to announce a new initiative to sincerely save lives and combat the opioid crisis locally. So as part of Mental Health Awareness Month and also in recognition of National Fentanyl Awareness Day, we're launching public vending machines offering free Narcan, also known as naloxone, and fentanyl test strips that are going to be available to the public 24/7. And we're inviting you to help us share this important story and this important initiative. We're officially kicking off this initiative with a ribbon cutting ceremony happening tomorrow. So Thursday, May 1st at 1 p.m. at the MST Salinas Transit Center at 110 Salinas Street in Salinas. So we're really excited to invite all of our media partners here to attend and help us spread the word about this sincerely critical public health effort. So I'll tell you a little bit about what's happening. So we've installed 4 vending machines at high traffic hotspot locations, including the Salinas and the Marina Transit Centers. Also, one of our new behavioral health access clinics in Pearl Street, as well as the Monterey County Jail lobby. So these machines are going to be stocked and are currently stocked with 200 doses of Narcan, as well as 50 fentanyl test kits each, with simple instructions that are available in both English and in Spanish. And so this is pretty important because we know that opioid overdoses claim over 100,000 lives in the US annually. And we know that Narcan can reverse overdose in just minutes with no special medical treatment needed. And when I'm speaking about Narcan or naloxone, I'm speaking specifically to the nasal method, not an injection. So anyone is able to administer this life-saving medication. And we know that widespread access to naloxone has been shown to reduce overdose deaths. And so these resources are completely free to the public. There's no ID required. There's no insurance required. It's just easy access for folks. And we're funding this project through our opioid settlement dollars. And this, I think, sincerely reflects our commitment to our community to really start with harm reduction to ensure that people are able to save a life so that person has the opportunity to recover. So I think what you can expect from tomorrow's event is the opportunity to interview with some of our health department and behavioral health department leadership and community partners, as well as visuals of the vending machines in action, and also how there are more details and ways that this initiative is part of a broader public health strategy in Monterey County. So I'm really excited to invite you all to join us tomorrow, May 1st, the kickoff of Mental Health Awareness Month, to share this powerful story with your audiences. And hopefully this helps amplify or, just really turn the volume up and focus on the message that saving lives should be as easy as pushing a button. So to learn more about this event, you can visit www.mtyhd.org, or you can contact us directly for interviews or press material. And thank you so much for having us.
Lindsay, thank you so much for running us through not only the important reason for the vending machines, but also what to expect tomorrow. I'm hoping you might talk a little bit more about why a vending machine? Is it just one way to get it out in a way that people are very familiar with?
Sure, I'm happy to speak to that. So we're really fortunate to have opioid settlement funds to pilot this initiative, and vending machines are a way that people can access life-saving medications on demand 24/7 without a fee or even a need to disclose the reason why you are seeking to have this life-saving medication available. So you don't have to go to your doctor, you don't have to go to a prescriber, you don't even have to walk into a store to purchase. It's no questions asked, and just having the means to save a life on your person at all times is really the intent of vending machine access for folks.
And so I do have a question that has come in from one of our media partners. Can you talk about why these specific locations were chosen for the vending machines? Are there plans to install some vending machines in South Monterey County?
Sure, I can speak to why we chose these specific locations, and Shiba can jump in around future plans. We're very interested and appreciative of our community partners who reached out and asked for these vending machines first and foremost, especially our MST partners. They're specifically chosen because those are hotspots for overdoses. We've heard stories and have information, especially from our local fire departments who are going out and providing this information, providing this intervention to our community members in these locations, as well as the foot traffic that we know are part of those locations. We also are really excited to have them close to people who are leaving or possibly visiting our local jail, because we know that there's specific people who are maybe more at risk for death due to an overdose because of their discharging from our local jails. As well as being part of our new behavioral health clinic in Pearl Street. We emphasize, co-occurring care, and that we welcome people kind of regardless of their disposition. And we think that this is one way to engage our public in accessing and learning about this medication. And then what are our future plans for distributing more of this? I can turn that over to Shiba.
So this is a pilot, our 2-year pilot, but we do plan on expanding. I started this project a year ago, and it is hard to find agencies and entities who would host the vending machine. So our hope is that when we do go live, there are any interested parties out there that want to partner with the health department, they reach out to us, and we can work on adding more kiosks throughout the county. When we began this process a year ago, I did reach out to all the cities in the South County, and we ended up setting up the little newspaper style kiosk. We have 26 of those little newspaper style boxes out throughout the county, which we will have on a map very shortly. So if there's anybody in South County who can host it, definitely reach out to the health department. We can talk about adding a kiosk out in South County.
Thank you so much, Shiba and Lindsay. And then one final question. You talked about the kiosk program being funded by opioid settlement. I think people hear about that, but they don't know, how does the money get to you? What do you do with this money? This is a really visible use of that opioid settlement money. Are there other projects that you fund with the settlement money?
Yes, we have other projects that we're funding with opioid settlement dollars.
Thank you. So this is just one of many uses of the settlement money.
Mm-hmm.
I have no other questions. Ladies, thank you so much for being here on the briefing today, and really best of luck on the event tomorrow. We hope we get a fantastic turnout, and we want to get everybody to know where those machines are just in case.
Thank you.
Oh, thank you. And so moving on to our next topic. Can a survey help improve health services in Monterey County? Yes, it can. That is the goal of the 2025 Community Health Survey. What do you think are the county's most pressing health needs? Here to tell us more about the importance of the survey and the importance of the Community Health Needs Collaborative is our friend Kalyssa King from the United Way of Monterey County. Kalyssa, thanks very much for being here. And before she gets started, we want to let you know that Kalyssa is giving our presentation in both English and Spanish. So if you want to listen to it in Spanish, just hold on and she will provide it. Hi, Kalyssa.
Yes, of course. Hi, Maya. Hi, everyone. Thank you so much for joining us today and for being interested in learning more about the Community Health Needs Assessment. It's a really important and critical collaborative and opportunity in our community, like Maya said, to get your voice heard about health needs that are pressing in our community. So just giving a little bit of backstory, because I think that that's really helpful. The Community Health Needs Assessment is a process that happens every 3 years for local hospitals and then also for our county's health department as well. Back in 2022, so I should say pre-2022, we were able to bring together partners throughout our communities. That included the health department, Me Memorial Healthcare System, Montage, Natividad, Salinas Valley Health, and then United Way in order to form the Monterey County Health Needs Collaborative. And what this group aimed to do was to come together in order to do that community health needs assessment as a team. Instead of each hospital and the health department doing them separately, bringing us all together so that we were looking at the same data and being able to then glean what were the most pressing health issues in our community. So now looking at 2025, we've been able to also include CSUMB and then also Central California Alliance for Health. So we've added some new partners in, but we have that same goal of looking at what are the most pressing health needs in our community through the Community Health Needs Assessment in order to understand health in our community and really set some key priorities for how we can overcome those health challenges. And so just to give more back context before we get into the call to action, what can you do right now? For example, in 2022, from the community or from the Monterey County Health Needs Collaborative, we were able to uplift across the county the 5 most pressing health needs. So those were diabetes, mental health, access to healthcare services, nutrition, physical activity and weight, and then heart disease and stroke. And you might be thinking, okay, now we know that those are the issues. What happens? So what then happens is every hospital and the health department and different partners are able to take that data and then they're able to create initiatives. And so an example of one initiative was that Me Memorial Healthcare System, in response to the pressing need of diabetes, were able to develop walking maps in King City and Greenfield so that community members could improve their physical activity and reduce the prevalence of diabetes by healthy lifestyle modification. And they created those routes in 1 mile, 2 miles, and 5 miles, and they're currently available on their website. So that's just one example of learning about the health needs and then creating a strategy in order to overcome. So you're probably thinking, what can I do right now? Our current community health needs assessment is live and we are currently collecting surveys. So the big ask is to go online and to make your voice heard. If you go to healthymontereycounty.org, there you're able to take the survey, and I'd be happy to share my screen and give a very quick demo of how you're able to find it. But really it's a 15-minute opportunity to remain completely anonymous, but sharing about your experience with health in our community so that you are able to have your voice be part of shaping what those priorities are. And as I mentioned previously, we do this every 3 years. So this is going to help set those priorities for the next 3 years. So it is extremely critical that we all take that opportunity to fill out the assessment. Along with that, if you've already filled out the assessment, thank you. But you can also go online. I know the health department will be sharing today some a social media post. So please reshare and then also talk to your family and friends. We want to get everyone's perspectives. So you can take the assessment, you can share about the assessment, and then also some members of our community may have already gotten phone calls or may be getting phone calls to do a phone survey. So if that is you, if you get the call, please answer and then take that phone survey as well. So those are really the 3 main asks. But like Maya said, this is a critical and super important initiative in our community in order to understand the most pressing health needs, and then for us all to be able to take action in order to improve health in our community.
So Kalyssa, go ahead. If you need to share your screen, I'd
Yeah.
love to have you show the survey. I took the survey 3 years ago and everyone was straight up saying it's not a 30-second survey, but it really was not difficult. It really went very quickly. It may have been 5, 10 minutes, but it really didn't take that long,
Yes,
or didn't feel like it did.
no, exactly. It should take around 15 minutes. We know that depending on folks' comfortability with the computer, and then also just as you're responding, the questions might take a little bit longer for some folks, but currently it's around 15 minutes is the projection. If you go to healthymontereycounty.org, you will connect over to this page on United Way's website. And if you scroll down, you'll see Monterey County Health Needs Collaborative. I have it really zoomed in right now, just so everybody is able to see well. If you need to transition the page over to Spanish, all you have to do is click this Espanol button and it will switch everything into Spanish. But to begin the survey, all you have to do is go ahead and click this red button and it will then open a unique survey link. And something really critical is that it is important to take the survey all at one time. You will not have that opportunity to go back because it is creating a unique link for you to take the survey. And if you do need to switch it into Spanish, you are able to do so once you're here as well. There also on this website is really great information about all of our partners. And then also, and I'll just scroll down very quickly, down to our past survey results. So if you heard me talking about, the last health needs that we discovered, and then also about that initiative, like I mentioned with Me Memorial, you can also come into here and see more information and then also all of the different reports. Because like I mentioned, we are working as a team, but we know that every single one of our healthcare systems, also the county health department, once we're all receiving that data, we have these countywide priorities, but there will be varying strategies. And so you're able to also get a little bit more detail and context if you come to this website on our past reporting too.
I think one of the I'm a report nerd. So I mean, not everybody loves to read the reports, but it shows you what the issues were. So if someone is looking to see, well, I took the survey, I wonder what people said 3 years ago, they can see that sometimes the issues are the same. Sometimes they're the same. Some things need more work than in just 3 years to resolve, but it's great to see results from people's action. And that's just, I mean, for someone who may be on the fence, like, do I want to spend 15 minutes taking this survey, to know that there was actually some outcome from it really makes a difference in saying, I'm going to spend my time to do this because I know something will happen.
Yes. No, May, you are exactly right. And I should have said this earlier, but a huge thank you. We had over 3,000 community members that participated in the process last time we implemented, so in 2022. So a huge thank you to honestly all of those community members that participated. We know that, carving out that 15 minutes is not a small ask. We have so many competing priorities that we're doing every day, and it really does matter to have your voice heard, share about your experience, your perspective, and it really does make that impact. So thank you to everyone that did participate. And like Maya said, please go look at the results, the reports, if you didn't have the opportunity from 2022. And then also a huge thank you to everyone who has already participated in the 2025 assessment. And if you haven't yet, it is not too late. Our survey will be open, and I should have mentioned this earlier, but we have about another month for the survey implementation. So don't wait, go ahead and do it today, but you still have time to participate in this really critical community assessment.
So end of May, and where are we at in terms of responses so far? I mean, 3,000 is a fantastic goal, and I'm hearing we're doing pretty good so far.
Yes, we are doing pretty good so far. There definitely are areas in our community at this point that we're noticing. We would love to see more representation. So it is really important that folks from throughout all of our county take that opportunity to really fill out that assessment. And I know, like I said, 15 minutes is not a small ask, but it is a huge impact that we're able to have by doing it.
And so a quick question, I know a lot of people do these things on their phone. And I'm a laptop person, but other people are phone people. Is the survey really compatible with doing on your phone? Have you had people respond that it was easy to do?
Yes, you are able to use it on your phone. I have not personally heard anyone share any concerns about taking it on your phone, but it you shouldn't have any issue just going to that website. The really important thing is that you click that button straight from the website to begin the survey, because it then starts that individual link in order to create your responses. So that's more I guess kind of the tricky thing is just not copying the link straight out of the browser, but going to healthymontereycounty.org and then clicking the button to start the survey.
Fantastic. So, Kalyssa, I'm going to give you a few minutes here to go over this in Spanish for those who are interested in taking the survey in their preferred language.
Yeah, of course, I'm happy to. So, buenas tardes con todos y todas. Mi nombre es Kalyssa King y yo trabajo por United Way. Es un placer para estar aquí hoy día con ustedes para compartir sobre una iniciativa muy importante en nuestra comunidad. Esa iniciativa está brindada por una colaboración, se llama Monterey County Health Needs Collaborative. Esa colaborativa es una iniciativa entre unos de los sistemas medicales aquí en nuestra comunidad. Eso está incluyendo al Departamento de Salud, también mi Memorial Healthcare System, Montage Health, Natividad, Salinas Valley Health y también United Way, Monterey County. Y hemos empezado esa iniciativa con las entidades que yo he mencionado antes, pero en ese año, en 2025, también estamos incluyendo al CSUMB y también al Central California Alliance for Health para brindar la evaluación de necesidades de salud comunitaria. Esa evaluación es muy importante en nuestra comunidad y está en el proceso de hacerlo cada 3 años. Esa oportunidad es muy importante porque lo que está pasando es que las personas pueden ir al internet para hacer una evaluación, una encuesta. Con esa encuesta lo que está pasando es que nosotros podemos hacer una lista de las prioridades de salud por los próximos 3 años. Estamos haciendo la evaluación cada 3 años y es muy importante porque cuando nosotros vamos a tener esas prioridades, nosotros podemos crear iniciativas para responder, ¿no? Para mejorar la salud en nuestra comunidad. Unos ejemplos son, en el año 2022, hemos hecho una encuesta y hemos descubrido las siguientes necesidades. El primero, el diabetes, después la salud mental, el 3, el acceso a servicios de salud, en el 4, nutrición, actividad física y también el peso. Y en el 5, la cardiopatía y el accidente cerebrovascular. Pues un ejemplo de la manera en que hemos utilizado esos resultados es mi Memorial Healthcare System. Ellos han hecho una iniciativa para crear mapas en King City y Greenfield para miembros de la comunidad para caminar. Y todavía esos están disponibles en su sitio de web. Pero esa fue una iniciativa para responder a la necesidad de diabetes, pero también a la necesidad para tener oportunidades para moverse, ¿no? En una manera física para su salud física. Pero eso solamente es un ejemplo de la manera en que hemos utilizado los resultados de la evaluación de 2022 y estamos implementándoles. Y eso es lo que vamos a hacer con las respuestas y la evaluación que estamos haciendo en ese momento en 2025. En ese momento estamos diciendo a miembros de la comunidad que es muy importante para hacer la encuesta. La encuesta solamente la duración es como 15 minutos más o menos y ustedes pueden ir a healthymontereycounty.org para hacer la encuesta y voy a hacer una demostración de eso. También, si usted ha hecho la encuesta, muchísimas gracias, pero también es muy importante para compartir la oportunidad con sus familiares, sus amigos, porque necesitamos la perspectiva de todos para crear la comunidad y mejorar la salud que queremos. Y aparte de eso, hay miembros de la comunidad que han recibido unas llamadas para hacer la encuesta, pero por teléfono. Pues si ustedes han hecho, muchísimas gracias, pero si ustedes están recibiendo esa llamada, por favor, toma la encuesta así. Pues hay 3 oportunidades para participar. La primera, para ir al sitio de web para hacer la encuesta. El segundo es para compartir la oportunidad con sus amigos, familiares, con todos, porque necesitamos su perspectiva. Y el tercero es, si usted recibe la llamada, por favor, toma la encuesta por teléfono. Y con eso, ahora yo puedo compartir a mi pantalla para mostrar el sitio de web en español. Pues espera un momento, voy a compartirlo. Oh, disculpe. Aquí. Okay. Aquí es. Pues cuando ustedes van a ir a healthymontereycounty.org, lo que va a pasar es que ustedes van a ir a ese sitio de web. Es una página que está en el sitio de web de United Way, Monterey County. Pero cuando ustedes van a ir abajo, va a ver ese botón para cambiarlo, para tenerlo en español. Y cuando ustedes van a tomar clic, todo va a cambiar para estar en español. Y como yo mencioné antes en inglés, en esa página, ustedes van a mostrar más información sobre esa evaluación de las necesidades de salud comunitaria. También va a ver toda la información de todas las organizaciones que están participando en la colaborativa. También ustedes pueden ir lo más abajo y van a ver los resultados del año pasado, de la encuesta, la evaluación pasado, que estaba en 2022. Y si ustedes quieren ver información sobre los informes o el sitio de web de las organizaciones que han participado en el pasado, también ustedes pueden ver todo eso. Pero para ir más arriba, aquí va a ser el botón para empezar la encuesta. Y cuando usted va a tomar clic o hacer clic en ese botón, va a ir a esa página. Eso va a empezar, va a tener un enlace como único para hacer la encuesta. Pues ese enlace es muy importante porque es como la oportunidad única para tomar la encuesta. Aquí ustedes pueden hacer clic para cambiar a la encuesta en español y va a tener la oportunidad para tomar toda la encuesta en español. Si ustedes quieren cambiarlo a inglés, también puede tomar, pero aquí en español para hacer la encuesta en español. Como yo mencioné en los comentarios que yo dije a Mea, en el año 2022 hemos tenido más de 3,000 personas que han participado en esa encuesta, pues es muy importante para escuchar la voz de todos ustedes. Pues si no han tomado la encuesta todavía, por favor, ustedes pueden ir a healthymontereycounty.org para hacerlo y por favor toma la oportunidad para cambiar la salud en nuestra comunidad porque su perspectiva es muy importante a nosotros. Muchísimas gracias.
Thank you so much, Kalyssa, for doing this 2 times. One last question before we wrap up on this topic. We talked about really that 3,000 survey target goal, and we've got about 1,000 or so maybe so far. Are there groups in the community or communities or kind of demographics that you're really looking at encouraging to say, try it, do the survey? Are we looking to get more men or women or, different age groups or different communities to take the survey?
Yeah, that's a really great question, Maya. So when we are implementing the survey, as we're working on sharing out with our community, the partners working, so all the different organizations that are working on this initiative, we are looking at that data to see where there might be gaps. And I know currently we have seen really great participation from a lot of areas in our community, but a lot of participation so far on the peninsula. So we would love to see, North, South County, and then Salinas Valley participating as well. And then I know also we always are looking, of course, for the responses in Spanish as well. I know that that's also a area that we would love to see increased response rates. And there's a lot of different demographics and they are constantly changing, of course, as folks are filling them out. But if for some reason though, you, for example, maybe speak English and are on the peninsula, please do fill out the survey. This is not to discourage anyone, but we would love to see more representation from those communities that I mentioned as well.
And for anyone who thinks that, well, I have the same problems as anyone else, you really don't know.
Yes.
People may look at it and go, well, I see all that and I'm the same as everybody else, but nobody has your story. So,
Yes.
Your story is an important part of the survey.
Yes, it really is. And I will say, I mean, when we think about 2022, and just because I participated in the 2022 Community Health Needs Assessment, you may think that your experience is the same as someone else's, and it's not. We have a lot of shared experiences, but even looking at those 2022 results, you might think, okay, those are the same problems, right? That maybe we're still experiencing, or for me, they at least are. But even thinking about how we thought about the community health needs assessment in 2022, we were asking questions in relation to COVID-19, the pandemic, where we changed a lot of material in order to be responsive now in 2025 to really the current needs, but making those shifts so we can collect new information as it might be helpful, but then also keeping a lot of the content the same in order to see how trends have changed. Because as we're doing some of these different initiatives and new opportunities in our community to respond to those health needs, that's what we're really hoping to see as progress, right? Having a healthier Monterey County where everyone is able to thrive. So yeah, you might look at those results from 2022 and think they're the same, or think that maybe somebody else will respond and have the exact same perspective as you, but you are unique, and we really want to hear about your experience with health in Monterey County.
Thank you so much, Kalyssa, for being here and doing this information in both languages. And we really hope for the best. And we hope you get your 3,000 and more for this year.
Thank you so much.
And thanks everyone for joining us on the news briefing this week. Our next briefing is next week, and we'll see you then.